a bunion is where the big toe of your foot angulates towards your second toe. It often is caused by soft tissue disruption, which allows the toe to turn that way. And as it progresses, it affects the other tissues around it, which can lead the toe to rotate as well. A lot of patients get pain from the inner side of the toe when it rubs on the footwear. So bunion surgery is something we do once we've exhausted all the other measures. And certainly it can incorporate several aspects. The key thing is to get the big toe nice and straight and giving it space. And this may involve breaking the bones to realign them and shaving off the bunion. And this can be done through an open technique, which means an incision of about 7 to 8 millimeters in length on the inside of your big toe. Or it can be done by what we call minimally invasive, which is through several stab incisions and then using X-rays to guide us for our cuts. Another more drastic version for people that have hypermobility in the midfoot is what we call a lapitus procedure, where we fuse one of the joints a bit at the base of the big toe, and this allows for the correction as well. So it's very much patient dependent. No, from my experience, from listening to patients and looking at our results postoperatively, we found that newer techniques of anesthesia, blocks, and certainly less soft tissue destruction with our surgical techniques has meant that the patients are saying it's less painful postoperatively than historically. And I think certainly as we're developing our techniques, it certainly is helping with this side of things. Other options before surgery is wearing wider fitting shoes, doing some exercises for the intrinsic muscles, and also some splints which can straighten the toe. The problem with the splints are once you take them off, the toe goes back into its position, and they also can be quite bulky within footwear. So I think the mainstay treatment is really wider fitting shoes. The ideal candidate for bunion surgery is a patient that is exhausted using other methods such as wider fitting shoes, and they feel that they're getting pain on a regular basis. I think it's when the pain's becoming regular that we need to consider surgical intervention, and surgery always has risk associated with it. So you want to get to a stage where the surgery is going to have a significant benefit on the quality of life of the patient. So post-operatively, normally day surgery, you go home the same day and you normally wear a slipper, which means you can weight bear, but you will use crutches for balance because obviously it's going to feel a bit awkward, particularly if you've had a block. I'd normally see you again at 2 weeks and check the wound and reduce the bandaging, but you remain in that surgical slipper with the support crutches for a further 4 weeks. And at that stage, if the x-rays look good and everything's going well, you can get back into normal shoes. As I say, you're weight bearing from day one, and it's just a matter of protecting this for the first 6 weeks.